Hi, Miriam.
Hello.
Today is May the 9th, 2014. You have been here for 2 weeks for treatment. Can you share with us what problem do you have and what's your experience?
Okay, well, I'm 24 years old. I have retinitis pigmentosa. I was diagnosed at the age of 21, and from then it's gotten much worse for the last year, and this is the problem I came for originally.
What vision challenges have you seen in your life?
Okay, well, as a RP patient, I've had a lot of difficulties. Mainly, it started with my color confusion. I know it differs from one patient to the other. Some it may affect the colors, so this was my main issue at the beginning, and now it's really night vision is very important because you need your independence to walk by yourself at night, and bumping into things. I started bumping into things where I had my blind spots, and also just recognizing people from far and just locating yourself, focusing. It's very difficult.
And after treatment, what changes have you experienced?
After the treatment, I have to say at the beginning, I wasn't very convinced. I had seen the videos on YouTube. I was very suspicious, and as I'm a person who I need to see to believe for myself. I can hear words, but I'm a person of actions. I need to see it. So I started a few days, 2-3 days. The third day, and every day feels like a long time because you spend all day at the clinic, which is nice because you're really being followed every minute of that time. And the first time I saw a change is when I actually walked into the Safeway in the grocery store. I was almost not sure if I was imagining or if it was really true, but it was true. I walked in and I could see very clearly as if there was a filter in front of my vision, and one of my biggest actually problems of why I bump into things and people and get confused is because I constantly have flashes and moving objects in front of my eyes all the time. I had something moving in front of my eyes, and that was all gone when I walked in the Safeway. I could see all the apples from far and the fruit, and I could see the contrast very well. I could see the cereal boxes from far away and read the signs, and it was just clearer. I wasn't confused. I wasn't trying to constantly locate myself, and that was really the first time I saw a difference. I was very happy. And at night also.
And change with your night vision?
Yeah, the night vision, yes. I'm not gonna say that it's 100%. I'm running a marathon at night. No, it's not. It is magical, but not to that extent.
What's the difference that compare with the before treatment?
The difference is really I feel more confident walking at night. I'm a little bit more calm when I walk at night too. I'm not so nervous, and that comes from the fact that you, without noticing that you see better, you just go for it because it's not something you'll notice and say, oh, I see better, I'm gonna walk. No, it's actually all in your brain, so you need to really adapt again to how you're seeing. So when I was usually have a lot of difficulties when I walk into a restaurant that's dark, and I always have a funny, clumsy experiences. But this time I was walking down the stairs, and I usually feel the stairs because I don't see them so well. And this time it was my head against my body. I was trying to feel them, but then I let go from the stair, from the handle, and I could see. So I said, okay, well, why do I need to feel the stairs? I see now. And I was just going down the stairs faster, and the road I can see better, the cars, the light. The cars are the contrast of the light is very strong at night. It's clear, it's clean. The vision is just more focused.
So normally you have glare to the headlight of cars before?
Sorry?
Do you have glare to the headlights of cars
The glare
at night?
is less.
Less.
Much less, yeah. It was very bad, to the point where even during the daytime I had as much difficulty walking. I remember when I was in Switzerland with my family, I had to hold on to my cousin constantly because it was just too confusing. The light was too bright, and now I could walk by myself and I'm okay.
And from our test, I can see your visual field is almost normal. Top is normal, left, right, bottom. Only very few, like 10 to 20 centimeters blind spots in your bottom field. And it's very remarkable progress.
Yes, definitely. I see now the test is very simple. It's a pen that goes around 180 degrees.
Yeah.
And what I at the beginning I didn't see that the pen all the way to my right, and my left side is a bit more difficult. My right side now I see the pen, and actually I had a blind spot at a certain point.
Yeah.
At a corner, and now I see the pen, and not just the shadow, I see the clear pen.
Yeah, the blind spot in the middle is collapsed.
Yeah.
Disappeared. Yeah. So it's your first 2-week program treatment. So
Yes.
we'd like to see you in 3 months and continue.
Yeah,
Continue.
I would like that. I will come back definitely, and not only for retinitis pigmentosa. That's not mainly the thing that was bothering me too, and I just had like bonus effects from the treatment. I feel much more relaxed. I also for the ladies, you would understand that the PMS symptoms have actually almost disappeared this month. I was very impressed, and no more headache, no bloating, no water retention. It was really nice, and even I had sinus, and now when I sleep better at night, I sleep
Sinus is
8
better too?
hours, and yeah, my sinus actually, my nose is not blocked when I sleep.
And before it's a problem?
Yeah, before I became used to it. I got used to the fact that every time I lie down, my nose just blocks, and then I heard, oh, you have to do an operation and this, and without even noticing, I just noticed I've been sleeping better. I don't know what it is, and then I noticed my nose is never blocked.
Congratulations! This is really a bonus, very good
Yeah.
bonus.
It's a 2-in-1.